While Cattell was changing forever the nature of American psychology by applying it to the measurement of mental abilities, a student of Cattell and Wundt was applying psychology to the assessment and treatment of abnormal behavior. Just 17 years after Wundt defined and founded the new science of psychology, we have yet another of his former students using psychology in a practical manner inconsistent with Wundt's actual intentions. Enter Leitner Witmer, 1867 to 1956. Leitner Witmer taught psychology at the University of Pennsylvania, filling that position when Cattell left for Columbia University, described as contentious, antisocial, and conceited. Witmer began the field he called clinical psychology. In 1896, he opened the world's first psychology clinic. The kind of psychology Witmer practiced in his clinic was not clinical psychology as we know it today, however. But Witmer did not use psychotherapy, a technique he detested and knew little about. Instead, he was interested in assessing and treating learning and behavioral problems in school children, an applied specialty area now called school psychology. Although Witmer was instrumental in developing clinical psychology, as it was defined at that point in time, the field has become much broader than he ever envisioned. Witmer offered the first college course on clinical psychology and started the first journal called Psychological Clinic, which he edited for 29 years. He was one of those pioneers of the functionalist approach to psychology who believed that the new science should be used to help people solve problems rather than merely to study the contents of their minds. Witmer offered the first college course on clinical psychology. Again, he was born in 1867 in Philadelphia. Witmer graduated from the University of Pennsylvania in 1884 and taught history and English at Philadelphia Private School before returning to the university to take law courses. He apparently had no thought of a career in psychology at the time, but changed his mind for a practical reason. He wanted a paid assistantship, and one of the few available was with Cattell in the psychology department. Here again we see the influence of economic forces in the new psychology in America. Witmer's biographer noted, quote, Witmer's actual entry into psychology was occasioned in part by the very down-to-earth need for the additional income that would be provided by an assistantship, end quote. Witmer began research studies on individual differences in reaction time and expected to earn his PhD from Pennsylvania, but Cattell had other plans. He thought so highly of Witmer that he chose him as his successor. This was a remarkable opportunity for the young man, but Cattell placed one condition on the appointment. Witmer would have to go to Leipzig to earn his doctorate from Wundt. Because the prestige of a German PhD was still paramount in the 1880s, Witmer agreed to go. He studied with Wundt and with Kolb. Titchener was one of his classmates. Witmer was not impressed with Wundt's research methods, calling them slovenly. He described how Wundt once made Titchener repeat an observation because the results obtained by Titchener were not such as Wundt had anticipated. Witmer served as a subject in Wundt's reaction time studies, but his service did not last long because his reaction times, quote, were the quickest ever recorded in Wundt's laboratory. This led to Wundt claiming that Witmer was not doing the task as a proper introspectionist should, end quote. Wundt refused to use Witmer's data, and Witmer quickly came to doubt the usefulness of the introspective method. Witmer later said that he had nothing out of his Leipzig experience but his degree. Wundt refused to allow Witmer to continue the reaction time work he had begun with Cattell and restricted Witmer's studies to introspective research on the elements of consciousness. Nevertheless, Witmer did receive his PhD, and he returned to his new position at the University of Pennsylvania in the summer of 1892. The same year, Titchener earned his doctoral degree and went to Cornell University. This also was the year another of Wundt's students, Hugo Münsterberg, was brought to Harvard by William James, and the year G. Stanley Hall started the American Psychological Association with Witmer as one of the charter members. The functional applied spirit had clearly begun to take hold of American psychology, with so much of it being led by Wundt's former students. For 2 years, Witmer worked as an experimental psychologist, conducting research and presenting papers on individual differences and on the psychology of pain. At the same time, he was searching for an opportunity to apply psychology to abnormal behavior. The chance came in March of 1896, resulting from an accident that originated in the economic circumstances of the time, the growth in funding for public education. Many state boards of education were establishing college-level departments of pedagogy, the study of the methods and practice of teaching. Psychologists were being asked to offer courses to education majors and to public school teachers working for advanced degrees. Psychology departments profited handsomely from this sudden influx of students because then as now departmental budgets were contingent on enrollments. Witmer taught some of the new courses established for public school teachers at the University of Pennsylvania. Okay, so here you have psychologists teaching students in education. In 1896, one teacher, Margaret McGuire, consulted Witmer about a problem with a 14-year-old student who was having difficulty learning to spell, although he was progressing in some other subjects. Could psychology help? Witmer wrote, quote, "It appeared to me that if psychology was worth anything to me or to others, it should be able to assist the efforts of a teacher in a retarded case of this kind." Of course, this is before we learned about mental disabilities and learning disabilities in children. Witmer organized a makeshift clinic and embarked on his lifelong work. Within a few months, he was preparing courses on methods for treating mentally defective, blind, and disturbed children. He published an article in the journal Pediatrics titled, quote, "Practical Work in Psychology," end quote, recommending that psychology be applied to practical affairs. He presented a paper on the topic at the annual APA meeting using the term clinical psychology for the first time. In 1907, he founded the journal Psychological Clinic, the first and for many years the only journal in the field. In the first issue, Witmer proposed the new profession of clinical psychology. The following year, he established a boarding school for retarded and disturbed children, and in 1909, he expanded his university clinic as a separate administrative unit. Witmer remained at the University of Pennsylvania, teaching, promoting, and practicing his clinical psychology. He died in 1956 at the age of 89, the last of the small group of psychologists who had met in G. Stanley Hall's study in 1892 to found the APA. Of course, now we see Witmer also developing not only practical psychology, but most importantly, clinical psychology. So, as the world's first clinical psychologist, Witmer had no examples or precedents for his actions, so he developed his own diagnostic and treatment approaches. Quote, "The absence of any principles to guide me made it necessary to apply myself directly to the study of these children, working out my methods as I went along," end quote. Children who had been referred to Witmer's clinic showed a broad range of problems, some of which he identified as hyperactivity, learning disabilities, so it started with Witmer, actually, and poor speech and motor development. As his experience and confidence grew, he developed standard programs of assessment and treatment. In time, he added physicians, social workers, and psychologists to the clinic staff. Witmer recognized that emotional and cognitive functioning could be affected by physical problems, so he had physicians examine the children to determine if malnutrition, then tested and interviewed by the psychologist, and visual and hearing deficits were contributing to a child's difficulties. The patients were tested and interviewed by the psychologist, while social workers prepared case histories on their family backgrounds. Initially, Witmer believed genetic factors were largely responsible for behavioral and cognitive disturbances, but he later realized that environmental factors were more important. He foresaw the need to provide a variety of sensory experiences early in a child's life, anticipating a Head Start type of enrichment program. He believed that it was necessary to involve families and schools in the treatment of his patients, arguing that if home and school conditions were improved, a child's behavior might change for the better. Of course, many psychologists soon followed Witmer's example. By 1914, almost 20 psychology clinics were operating in the United States. the majority pattern on Witmer's clinic. In addition, the students he trained spread his approach and taught new generations of students about clinical work. Witmer's influence spread to the area of special education. His student Morris Viteles extended Witmer's work by establishing a vocational guidance clinic, the first such faculty in the United States. Other followers applied Witmer's clinical approach to adult patients. In addition to Witmer's efforts to apply psychology to the assessment and treatment of abnormal behavior, two books provided an impetus to the new field. Clifford Beers, a former mental patient, wrote a book titled A Mind That Found Itself in 1908, which focused public attention on the need to deal humanely with mentally ill people. Hugo Münsterberg wrote a book titled Psychotherapy in 1909, also widely read, which described techniques for treating a variety of mental disorders. And as we will see later, Münsterberg promoted clinical psychology by describing specific ways in which disturbed people could be helped. The ideas of Sigmund Freud, which we will speak about later, were crucial to the advancement of clinical psychology and moved the field far beyond its origins in Witmer's clinic. Freudian psychoanalysis both fascinated and outraged segments of the psychology establishment and the American public. Freud's ideas provided clinical psychologists with their initial psychological techniques of therapy, however. Nevertheless, clinical psychology advanced slowly at first. As late as 1918, 9 years after Freud's visit to the United States, there were still no graduate programs in clinical psychology. Even by 1940, clinical psychology remained only a minor part of psychology. Few treatment faculties existed for disturbed adults, and consequently there were few job opportunities for clinical psychologists. Training programs for new clinical psychologists were limited, and their job duties rarely extended beyond administering tests. The situation changed dramatically, however, when the United States entered World War II in 1941. Large numbers of draftees showed up at induction centers with severe anxieties, depression, antisocial demeanors, uncontrolled anger, and generally unstable psychic presentations. They were bedwetters, dropouts, chronic misfits. By the time the war ended in 1945, almost 2 million men had been rejected for military service for psychiatric reasons. Of those accepted, 1 million had to be hospitalized for treatment of mental disorders during their time on active duty, and another 500,000 were discharged for the same reason. The military leadership quickly concluded that a lot of men needed help and that there were not enough psychologists or mental health counselors to do the job. That helped make clinical psychology the dynamic applied specialty area it has become today. The Army established training programs for hundreds of clinical psychologists so that they could treat the emotional disturbances of their military personnel. After the war, the need for clinical psychologists was even greater. The Veterans Administration, the VA, which is now the Department of Veteran Affairs, the DVA, found itself responsible for more than 40,000 veterans diagnosed with psychiatric problems. More than 3 million others needed vocational and personal counseling to help them return to civilian life. And some 315,000 veterans needed assistance in adjusting to physical disabilities resulting from war wounds. The demand for mental health professionals was staggering and far exceeded the supply. So you had not only had soldiers and warmen who were dealing with their wounded physical handicaps, but they also had psychological wounds from the destructions that war can cause on the psyche. And so to help these needs, the VA, the Veterans Administration, funded university-level graduate programs and paid tuition for graduate students willing to work at the Veterans Administration hospitals and clinics. One outcome of these programs was that clinical psychologists began dealing with a different type of patient. Prior to the war, most of their work had been with children who had delinquency and adjustment problems, but the veterans' post-war needs brought about adult patients with more severe emotional problems. The Department of Veterans Affairs remains the largest employer of psychologists in the United States today in the 21st century. So the VA played a really important part on finding jobs for clinical psychologists. Today, clinical psychologists are employed in mental health centers, schools, businesses, and of course, private practices. Clinical psychology is the largest of the applied specialty areas in psychology, which with more than 1/3 of all graduate students enrolled in clinical programs. Then we move on to what's called the industrial organizational psychology movement. Industrial organizational psychology. Another American student of Wundt's at Leipzig, Walter Dill Scott, left the world of pure introspective psychology to apply the new science to advertising and business. Walter Dill Scott dedicated much of his adult life to make the marketplace and the workplace more efficient, and to determine how business leaders could motivate employees and consumers. So we see here a trend of these German psychologists, the new science of psychology starting in Germany. These educators being educated, these students, graduate students, and PhD students getting their PhDs in Germany, and then coming back with their PhDs or graduate degrees from Germany to America, where psychology found a new place. So a lot of the German universities were high education at that time, universities themselves coming from Europe. These psychologists were educated in Germany under the pioneers of the new science of psychology, and then they came to the United States and then developed their own disciplines here. And that's why psychology was really found its roots in Germany and the Americas, particularly the United States, because of that. And of course, obviously, the American Psychological Association is the largest largest association of psychologists in the entire world. And I think that we see here a trend in the history of psychology. So, Walter Dill Scott, 1869 to 1955. His work reflects the concern of the functionalist tool of psychology with practical issues. One historian of psychology noted, quote, upon returning from Wundt's Leipzig to turn-of-the-century Chicago, Scott's publications shifted from Germanic theorizing to American usefulness. Instead of explaining motives and impulses in general, Scott described how to influence people, including consumers, lecture audiences, and workers, end quote. Scott compiled an impressive list of firsts. He was the first person to apply psychology to personnel selection, management, and advertising. He was the author of the first book in the field of industrial organizational psychology. He was the first to hold the title of Professor of Applied Psychology. He was the founder of the first psychological consulting company and the first psychologist to receive the Distinguished Service Medal from the United States Army. So, born on a farm near the town of Normal, Illinois, Scott was struck by the idea of workplace efficiency while he was plowing a field. Because his father was often ill, the 12-year-old boy bore much of the responsibility for the operation of the small family farm. One day he paused at the end of a plowed furrow to rest his two horses. Gazing in the distance at the campus buildings of Illinois State Normal University, he suddenly realized that if he were ever going to achieve anything in this world, he would have to stop wasting time. Here he was losing 10 minutes out of every hour's plowing to rest the horses. That added up to about an hour and a half every day, time he could use for studying. Scott decided to carry books with him and to spend every spare moment reading. To earn his college tuition, he picked and canned blackberries, salvaged scrap metal to sell, took on odd jobs. He saved some of the money and spent the rest on books. At age 19, however, he enrolled at Illinois State Normal University to begin his long journey away from the farm. 2 years later, he won a scholarship to Northwestern University in Evanston, Illinois, and took tutoring jobs to make extra money. He played varsity football and met Anna Marcy Miller, the woman he would then marry. He also chose his career, deciding to become a missionary in China, although it meant 3 more years of study. By the time Scott graduated from a Chicago theological seminary, prepared to depart for China, there were no vacancies for missionaries. China was full. It was then that his thoughts turned to psychology. He had taken a psychology course, and he liked it, and he had read a magazine article about Wundt's Leipzig laboratory. With his scholarships, tutoring, and frugal lifestyle, Scott had saved several $1,000s, enough to pay for the passage to Germany and to get married. On July the 21st, 1898, Scott and his bride departed. While he studied with Wundt, Anna Miller Scott worked on her PhD in literature at the University of Halle. 20 miles away. Often they saw each other only on weekends. Both received doctoral degrees 2 years later. Scott joined the faculty of Northwestern University as instructor of psychology and pedagogy, showing that he was already influenced by the trend towards applying psychology to problems in education. A few years later, his interest changed when an advertising executive asked him to try to apply psychology to make advertisements more effective. The idea intrigued him. In keeping with the spirit of American functionalism, Scott's path continued to diverge from Wundtian psychology as he found more ways to use psychology to deal with real-world concerns. Scott wrote a book titled The Theory and Practice of Advertising in 1903. It was the first book on the topic and followed it with another book and several magazine articles. His expertise, reputation, and contacts in the business community broadened. He also directed his attention to problems of personnel selection and management. In 1909, he became professor of advertising at Northwestern University's School of Commerce. In 1916, he was appointed professor of applied psychology and director of the Bureau of Salesmanship Research at Pittsburgh Carnegie Technical University. When the United States entered World War I in 1917, Scott offered his skills to the Army to help select military personnel. At first, Scott and his proposals were not well received, as not everyone was convinced of psychology's practical value. The Army general with whom Scott dealt was outraged and voiced his suspicions of professors. Quote, "He said it was his function to see that college professors did not get in the way of progress, that we were at war with Germany, and that we had no time to fool with experiments." End quote. Scott calmed the irate man, took him to lunch, and persuaded him of the value of his selection techniques. Apparently, Scott proved his point. The Army later awarded him its Distinguished Service Medal. After the war, Scott formed his own company, called imaginatively the Scott Company, to provide consulting services to corporations on problems of personnel selection and worker efficiency. He also served as president of Northwestern University from 1920 to 1939. The university's Scott Hall is named for Walter Dill Scott and his wife, Anna Miller Scott. The imprint of Wundt's psychologically oriented experimental psychology can be seen in Scott's attempt to extend it to the realm of the practical in his writings on business and advertising. For example, he noted that the human sense organs were the, quote, windows of the soul. The more sensations we receive from an object, the better we know it. The function of the nervous system is to make us aware of the sights, sounds, feelings, tastes, etc. of the objects in our environment. Advertisements are sometimes spoken of as the nervous system of the business world. The advertisement of musical instruments, which contains nothing to awaken images of sounds, is a defective advertisement. As our nervous system is arranged to give us all the possible sensations from every object, so the advertisement, which is comparable to the nervous system, must awaken in the reader as many different kinds of images as the object itself can excite. End quote. Scott argued that because consumers often do not act rationally, they can be easily influenced by advertising. He cited emotion, sympathy, and sentimentality as factors that heighten consumer suggestibility. He also believed, as was common at the time, that women were more easily persuaded than men. Applying his law of suggestibility, he recommended that companies use direct commands, such as use Pier's soap, to sell products. He promoted the use of return coupons because they required consumers to take direct action, such as tearing the coupon out of the newspaper, filling in their name and address, and mailing it to the company to receive a free sample. Of course, these techniques were eagerly adopted by advertisers, and by 1910 they were widely used. I won't go into propaganda at this point. But for selecting the best employees in the realm of employee selection, especially among salespeople, business executives, and military personnel, Scott devised rating scales and group tests to measure the characteristics of people who were already successful in those occupations. Like Witmer in clinical psychology, Walter Scott had no prior work on which to base his approach. He questioned Army officers and business managers, asking them to rank their subordinates on such qualities as appearance, demeanor, sincerity, productivity, character, and value to the organization. He then ranked job applicants on those same qualities found to be necessary for effective job performance, a procedure similar to that is in use today. Scott developed psychological tests to measure intelligence and other abilities, but instead of assessing individual applicants, he constructed tests to administer to groups. When large numbers of candidates have to be evaluated within a short period of time, it is more efficient and far less expensive to test groups. Scott's test differed from those being developed by Cattell and other applied psychologists. Scott was not only measuring general intelligence, but in addition was interested in determining how a person used his or her intelligence. In other words, he wanted to understand how people processed information and how intelligence operated in the everyday world of experience. Scott defined intelligence not in terms of specific cognitive abilities, but in practical terms such as judgment, quickness, and accuracy. The latter were the characteristics needed to perform well on a job. He compared applicants' test scores with the scores of successful employees and was unconcerned with what those test scores might signify about mental elements. So, to sum up, for many years, Scott, like Witmer, received only passing attention in the history of psychology. In fact, many people have never even heard of these people. There are several reasons for this neglect. Like most applied psychologists, Scott formulated no theories, he founded no school of thought, he trained no loyal core of students to continue his work, he conducted little experimental research, and he published rarely in the mainstream journals. His work for private corporations and for the military was strictly problem-oriented. Many academic psychologists, particularly those in tenured positions with major universities and well-funded laboratories, discounted the work of applied psychologists, believing that it contributed little to the advancements of psychology as the actual science. Scott and other applied psychologists disputed this notion. They found no conflict between applying psychology and advancing it as a science. Applied psychologists argued that bringing psychology to the public's attention demonstrated its worth, which in turn increased the recognition of psychological research in the academic laboratories. Thus, the pioneers of applied psychology reflected the American functionalist spirit and the goal of making psychology useful.